I'm sure that at least 50% of you watching this video right now is suffering from acidity, or as we call it, GERD, gastroesophageal reflux disease. So in GERD, like the name suggests, there is reflux of acid and contents back into the esophagus from the stomach. So the most common risk factors are a high body mass index, tobacco smoking, and very importantly, sedentary lifestyle, which includes unhealthy eating habits and less physical activity. So one of the most common symptoms that people with GERD have is a heartburn, which is like a burning sensation anywhere in the upper abdomen or upper chest, or sometimes even in the throat. Now, another very common symptom that people usually have is a feeling of a lump in your throat or something stuck in the throat. A lot of people also have symptoms like frequent burping, frequent throat clearing, feeling of a sour taste at the back of your tongue, or sometimes even feeling the regurgitated contents in your throat. Some people also experience some atypical symptoms like chest pain, which needs thorough evaluation to make sure that it is not related to any other diseases like cardiac issues. Some other people experience choking sensation or tightening in the throat, and even increased cough or irritant cough after lying down, which is why we usually advise not to lie down immediately after your meals. Now, GERD may not feel like a big deal to you because a lot of people around us face acidity issues, and so we tend to normalize it. The problem is that our esophagus is not designed to be exposed to these gastric acids. So exposure to these acids over a long period of time can actually lead to change in the lining epithelium of the esophagus. So most commonly GERD is just diagnosed clinically based on the symptoms. But in people who don't have any improvement with medications, or people with chronic GERD, we may need to do tests like upper GI endoscopy to evaluate for any other correctable causes and to look out for any changes in the lining epithelium. So since acidity is the issue, the treatment is going to be using antacids. The annoying part is that once you stop medications, these symptoms might just come back. So just using medications will not solve your problems. So it is very important to combine your medications with lifestyle modifications. There have been enough studies to prove that people with a higher BMI, after weight reduction, there is significant reduction in GERD symptoms due to less pressure on the lower esophageal sphincter. Similarly, there are enough studies that also prove that stopping tobacco smoking also helps in reduction of GERD symptoms, because tobacco smoking leads to relaxation of the lower esophageal sphincter, which causes the reflux symptoms. Have less spicy, less oily, and less fried foods. Tea and coffee has been proven to stimulate gastric acid secretion. So it is advised to limit your tea coffee consumption to 1 or 2 glasses per day, and also advised to not take tea or coffee on an empty stomach. Some other modifications that we advise are to have an early and light dinner. Make sure that there is at least 2 to 3 hours gap between your dinner and going to sleep. Like I already told you, a sedentary lifestyle is a huge contributing factor to GERD. Making sure that you have healthy eating habits and that you include some physical activity in your daily routine is very important. We'll probably stick to all of this for a week and then just go back to taking medications. The truth is that you cannot take these medications for lifelong. And the reason we give medications in the beginning is because these lifestyle modifications take time to actually show some effect. So we cover the initial period with medications while you are working on your lifestyle modifications, so that we can slowly bring down your dependency on these drugs, and we can maintain a moderate level of modifications that you can sustain throughout your life. I hope you guys like this video and make sure to follow all the advice that I gave you. It will really help reduce your symptoms.